it is clear that the Republicans are afraid of Medicare for all. Not just they're not afraid. I mean, of course they're afraid of it as a policy prescription, but it has incredible salience as a political issue, right? Donald Trump gets out there, writes an op-ed full of lies. Here's Paul Ryan getting up in front of the National Press Club. I guess this was yesterday. Also, delivering out the lies. And I have to say that, like, I want you to be very careful. Listen carefully to how Paul Ryan juxtaposes these sentences. Like, he is playing off the ignorance that is not only in the Republican Party, but frankly across the electorate as to what Medicare is. You know, we've heard those stories where Republicans are saying, you know, get the government hands off of my Medicare. And this is more of that in many respects. And it is incumbent upon all of us and media outlets and to explain that government's hands are not only all over Medicare. Government, its entire body is all over Medicare. It actually emanated from government.
You're communing with government.
Indeed. And here is Paul Ryan lying and practicing, you know, how Republicans are going to try and push back on the idea of Medicare for all.
They now call it Medicare for all because it sounds good. But in reality, it actually ends Medicare in its current form.
Pause it. Now, Paul Ryan years ago came out with a proposal to privatize Medicare. And the Democrats pushed back by saying it's not Medicare. And Paul Ryan said, no, I call it Medicare. And the press also sort of bought, well, he does call it Medicare. It is Medicare. It's just changing it. And people were like, well, but the essence of Medicare is that it is government-provided health insurance. And if you privatize it, it is no longer that. So it is not Medicare in its present form. It is expanded Medicare. I mean, this is why, like, you know, when, you know, there is value in sort of the way you present this stuff. Like, Medicare for all could just be Medicare Part A, let's say. We're going to call it Medicare Part A, Medicare for all. I mean, just so that he can't do these rhetorical tricks. Because people, frankly, are not savvy about this. Cue my book, Blame the Electorate. But continue with Paul Ryan.
It ends private insurance altogether.
All right, pause it. So he juxtaposes it's not Medicare as we know it. It ends private insurance as we have it altogether, implying that Medicare is private insurance. Now, there is a component of Medicare which is private insurance. That is the Medicare Advantage program. That was shrunk from the ACA because they were getting overpaid, but the services delivered were not shrunk. And Medicare for all, incidentally, it's very unlikely that it would end all private insurance. There could conceivably be private insurance that is issued in as a supplement to Medicare for all. Certainly we have that in places like France. Just about every place that has a Medicare for all type program, a single payer, there is a supplemental private insurance if people want that, wealthy folk.
It's called Bupa in the UK, apparently.
Bupa?
I'm not sure what it stands for, the British something.
Okay,
blah,
but
blah, blah.
but again, Medicare for all resolves a lot of the issues of Medicare. Almost the idea of Medicare for all is to get rid of private insurance. But
it ends private insurance altogether, including for the roughly 180 million people who count on health insurance coverage through their employer. Everyone, no matter how much you like your plan, would have their plan taken away. Instead, you will be put into a government-run plan where you have no say in the cost or in the coverage.
Pause it. Well, you do have a say in the cost, insofar as it won't cost you anything. Now, you could theoretically say, I want it to cost more, but that would be very atypical of an individual. And in terms of the plan, there is no plan. There's no plan insofar as you're not limited. You get to see all doctors because they all take Medicare. Because what else are they going to do? Continue.
Obamacare meant fewer choices. Medicare for all means no choices, no competition.
Pause it. That's right. You won't have to make any choices. You'll just be able to do what you want to do in terms of seeing your doctor. Obamacare limited choices because it's based on private insurance. Continue.
How much do you get charged for this? That's a good question. A nonpartisan study found that a single-payer program...
It's a great question because you won't know what you're going to get charged for it because you're going to get... It's zero is the answer. You'll be charged zero. Maybe there'll always be like a copay, like a $20 copay. I think when I was in Australia, visiting Australia 20, 30 years ago, they had a similar style program. And I'd go see a doctor and I'd have to pay like $12. I wasn't a citizen. I was just going in, see the doctor. Go ahead.
A nonpartisan study found that a single-payer program like this would cost the government a whopping $32.6 trillion over the next 10 years. Just to put the price tag of this idea in perspective.
Pause it. Let me put it in perspective for you. The Mercatus study that he's referring to, Mercatus, $32.6 trillion over the next 10 years. I will be able to put that into perspective for you. That is $2 trillion less than that study says we will as a nation spend on healthcare if we don't go to a single payer thing. So it is almost like 8% less. We'll have 8% savings on what the national cost, the nation as a whole, private and public sectors, will expend on healthcare. So it's an 8% savings. How's that for a perspective?
We could double all federal taxes. Yours, mine, families, businesses, everyone's taxes, and still not be able to pay for this. The only way you could control costs would be to ration care and restrict access to doctors and treatments. All of these decisions would be made in Washington, of course.
This is absurd. What does that mean, ration care, in this context? The care is there. There's nowhere else to go. You're not saving it for anybody else.
Does he think that care isn't rationed now by the market?
Care is, of course, rationed now. And what he's talking about is you're going to actually, by rationing, it means like the doctors may not get paid as much.
Yeah, plus the costs would go down because when you have one payer, right, the government, they can tell the drug companies to charge less and they don't have a choice. It's like deal or no deal.
The rationing is, first of all, I think he's lying about the double the federal taxes. I think if you double federal taxes, I think we pull in about $3.5 trillion annually, somewhere around there. And I think people can do the math. 10 times 3.5 is actually $35 trillion. Now, of course, people will be saving more because they expend that in terms of private care. But that doesn't even imagine like the increase in productivity that we would get under a single payer. I mean, like, I don't know. How many hours a week, a month does someone spend on dealing with their health care? 4, 5, 6 hours a month? Maybe more? What about all the doctors and all the paperwork? I mean...
The anxiety, too.
And the anxiety. So,
the anxiety, the worry.
But there's Paul Ryan. They are nervous about the not only the policy of Medicare for all, but they are nervous it is a winner for Democrats. And that is why I would imagine, I don't know this for a fact, but anecdotally, I think probably a majority of Democrats running for office now are embracing Medicare for all. What that means individually to each one of them, I don't know, but that is a nice starting point for this election.
Well, in the lead into the Trump call on Fox and Friends yesterday, I think one of the Fox and Friends said that it was the number one issue basically everywhere.
Healthcare is the issue that everybody seems to be running on.
Finally. And this is so much better than the ACA was, because some of those Republican attacks on the ACA stuck. They were valid. It was still really expensive to get healthcare in the marketplace, and it didn't cover a lot. Like, I didn't like my plan that I could only afford because, full disclosure, my parents were helping me pay for it that I was forced to buy. Like, it sucked. So, like, you can't make those attacks on Medicare for all. It's so simple and it's so clear.
They're I think extremely nervous of something like that being rolled out.